Thrombophlebitis, very quickly. Hopefully you've had this in med-surg. My question to you is, do we do a Hohmann sign? No, we don't. In most hospitals, we do not. The current thinking is Hohmann sign, you may, by doing that kind of assessment, you may help a clot break free and then you've got an emboli, which is not good. So what is the alternative? Think about this. Every time you take a step forward, aren't you dorsiflecting your foot? That's like a Hohmann sign. So we're asking her about leg pain as she's walking. A Hohmann sign, a positive Hohmann sign or a positive clot in the calf is going to cause sharp, severe pain. It's not a muscle ache. We're looking for, the calf is usually where it happens, but we're also looking for pain in the leg, the inguinal area, and the lower abdomen. Unusual pain. We're looking at edema. Now that's edema on one side, and it's below the clot. So when you look at their feet, one foot is much more edematous than the other. One leg or foot is a different temperature than the other. And this particular slide says pain with palpation. Well, you really should not be palpating. Again, we are worried about breaking a clot free. So please don't palpate. If you've got a concern, you're going to refer it on up the line, get a physician, nurse practitioner, somebody else to check her out first. How can we help to prevent it? Well, bed rest is the bad thing. We don't want them lying in bed for a long time. We want to get them up, moving around, and we don't want them just sitting or standing. For those in the hospital, that usually means sitting all day. You don't want them sitting all day. You want them to get up and move around. Avoid crossing the legs. And if they've had the clot once, they really need these teaching because they're going to be at risk for getting it again. You don't want them to take these huge, long car trips. Get out, get up, go to the bathroom every now and then to get the blood moving. So self-care includes, let's talk to her about the condition, let's talk to her about the treatment, let's talk to her about all those mobility issues we did in the previous slide. If they're on anticoagulants, obviously let's talk about what do you need to think about so you don't cut yourself, so you don't bruise yourself, and ways of avoiding stasis. That's your mobility issues again.